All right, this is a 550 gram, 25 weeker that was just born, and we're gonna go ahead and do an intubation and provide surfactant administration to try and help with respiratory distress. Chris is providing PPV while we are awaiting the supplies to be gathered for surfactant via the T-piece of the neopip.
Okay. I'm going to do a quick section before.
Once we've gathered the supplies, please refer to the pictures in the previous slide. We're going to suction prior, and then we'll rebag real quick just to be able to provide a little bit of reaccumulation of the lungs. Jenna has grabbed all the supplies for intubation while Katie is pulling up the surfactant. We have our surfactant here, and you'll need a syringe, and we'll have to warm it as best we can prior. As gently as possible, we're going to do an intubation. Because the baby is 550 grams, we're using a 2.5 ET tube. We also chose to use a stylet to help guide our ET tube in the proper place. Once we're intubated, I'll take over if you want. Then the person that has the stethoscope will determine if we have bilateral breath sounds, along with having a CO2 detector to see if we have color change, which we do. Bilateral breath sounds.
Yes. We got tape right here.
The RT will tape the ET tube in place. The easiest process is typically to cut the ET tube a little bit shorter to be able to attach the other Y connector from the multi-access catheter. Once placement is confirmed, then we're going to go ahead and cut off at an angle the top of the ET tube. And then we will place the multi-access catheter in so that we will be able to provide our surfactant. After you cut at an angle, then you're going to take off the original, I don't know what those are called, and put on the surfactant administration Y connector. Then they're going to prime the catheter. So once we have the surfactant connected to the catheter, they will prime the catheter with a little bit of the surfactant, and then they will insert the catheter into the ET tube to match the depth of the ET tube. The numbers will match. That's when we'll instill approximately 1/3 to 1/2 of the medication, pull back out the catheter, and provide PPV. Sometimes you will see some of the surfactant come back up as they're slowly absorbing it, but don't be discouraged. We'll just keep providing PPV, and it should slowly absorb. Once that is completely absorbed, then you put back down the catheter and then instill the remaining of the surfactant, pull back out, and provide the PPV. Depending on the disposition of the infant, whether you're just doing in and out surfactant or if you're providing surfactant and leaving the ET tube in, that's going to determine your next course of action. We can either pull it out if we're doing in and out, or we will leave it in and go to the unit or stay in the unit as needed.
The end.